Good morning. Welcome to ePathshala. Main subject social medicine and community health, and the sub-subject healthcare delivery system, which we have been discussing. And now we will start covering the job responsibilities of health education officer or the health educator. Who is the health educator? Of course, first of all, thanks to the development team under Professor C.P. Mishra and Professor Nizam Khalid. And coming to the learning objectives, we have to actually demonstrate ability to understand the meaning and importance of health education. Importance of health education, what is health education, we have to understand, and we have to demonstrate the ability to understand the various IEC, in other words, information, education, communication, and the activities, and to know the functions and responsibilities of the health educator. Now, who is this health educator actually? So, in order to introduce what is health education, I have been talking about health education, IEC activities in all my lectures. Health education is when you take a subject and you try to explain it to your client in such a manner that he or she is able to understand the importance of that subject being included in their daily lives. You want, for example, health education about good water. What is there to educate about good water? Good water is good. You drink it, very nice. No. Good water has a separate meaning for every single person under different circumstances. Good water for us means it should be bacteriologically zero. So we have AROs, etc. The RO filters, etc. We have filters. We put chlorination. We use tablets, and we use expensively designed filters in order to give us good water for us. What is good water in the community? Good water in the community will be that water, if they consume, that must be healthy to them, they don't fall ill, and they don't have diarrhea, they don't fall sick. Now, how to get that achievement of good water status? This is the procedure of explaining to him how to get that good water right from the point of supply to the point of consumption. I would call it as health education. So, health education is actually a profession. It is a wide subject. It is a historical subject. And this is a subject of educating people about health. Areas within this profession encompass environmental sanitation, physically, in our medical terminology, in our medical world, in this world of primary health care, in which we are talking about educating the rural mass. Health education becomes important because through health education, we can affect environmental health, we can give good physical health, we can give good social health, emotional health, intellectual health, and spiritual health. It can also be defined as a principle by which individuals and groups of people learn to behave in a manner conducive to the promotion, maintenance, and restoration of health. So therefore, health education by any means is not a simple subject. It is a scientific subject, and its presentation to the consumer is also scientific. Now, how do you define health education? I have defined it in my own fashion in order to explain to you what is health education. Now, a technical definition given by the department, science department or department of education will be, now for example, a joint committee on health education and promotion terminology of 2001 has defined, it is any combination of planned learning experiences based on sound theories that provide individuals, groups, and communities the opportunity to acquire information and the skills needed to make quality health decisions. And the World Health Organization has said it comprising of consciously constructed opportunities for learning involving some form of communication designed to improve health literacy, including improving knowledge and developing health life skills which are conducive to the individual and to community health. They are very difficult definitions, but try and remember that if you ever in your everyday life try to explain to a little child of simply washing his hands before eating his food, and that by washing his hands he will get rid of all the dirt and all the germs which will not go into his stomach, that is health education. So, health education, let us now define now who is a health educator. In my terminology, every single person can be a health educator, but when we are talking in terms of a program, health educator is a professionally prepared individual. Now, he is also a trained person, prepared individually who serves in a variety of roles and is specifically trained to use appropriate educational strategies and methods to facilitate the development of policies, procedures, interventions, and systems conducive to the health of individuals, groups, and communities. This was from the Joint Committee on Terminology 2001 document. There are 7 areas of responsibilities for our health educators. What are those areas? Responsibility 1. We are assessing individual and community needs for health education. Now, when you send a person when you are actually running a community program, it becomes absolutely essential that these health educators who have been trained in community education come to the help of the normal people who are going to be working there. Your health worker male, your health worker female, your health assistant male, health assistant female, they are all good in their subjects, but it is not possible that they might be good health educators. Hence, the use of a scientifically trained person known as a health educator. Now, what is his responsibility? He assesses individual and community before giving health education, find out if health education is necessary and in what aspects. So, therefore, then he provides the foundation for program planning. He determines what health problems might exist in any given group. He includes determination of community resources available to address the problem. Community empowerment encourages the population to take ownership of their health problems, and he includes careful data collection and analysis. And what is the responsibility 2? Action plan the act. Now, after collecting the facts which are responsible and what is needed, then you have to plan health education strategies, interventions, and programs. These actions are then based on the needs assessment done for the community and involves the development of goals and objectives which are specific and measurable. Interventions are developed that will meet the goals and objectives according to rule of sufficiency. Strategies are implemented which are sufficiently good, effective enough, and have a reasonable chance of meeting the stated objectives. So, therefore, these are absolutely essential in planning his activities to further the acceptance, to further the happy acceptance of these national programs or interventions or strategies at the primary healthcare level. Now, what is the responsibility? Implement education strategies and interventions and programs. Implementation actually is based on a thorough understanding of the priority population and utilizes a wide range of educational methods and techniques. Now, what does this mean? Implementation is based on a thorough understanding of the priority population. See, it depends on what type of a rural population or an urban population is there. Because understanding of problems, acceptance of problems will vary according to the communities in which we are working. We are talking about slum communities, they have different set ideas. So their acceptance of these programs will be on a different level. Going to the villages, their acceptance, their understanding will be on a different level. Go up to the tribal areas, go up to the mountain areas, their understanding, acceptance may be very slow. So hence, techniques to be applied, and with each setup and with each stage, the technique, the utilization manner, the teaching manner will change, the language will change, and the health educational techniques of communication, because you might not be able to, you might only need to show pictures, you might need to show dramas, you might need to talk to them. And so hence, so what are the different educational methods? So somewhere you will have written material, somewhere you will have video material, somewhere you will need to talk, somewhere you might need to sing. So you have all sorts, all this comes under different sorts of educational methods and techniques. Now, responsibility for, they have to actually conduct evaluation and research related to health education, depending on the setting, utilize tests, surveys, observations, tracking epidemiological data and other methods of data collection. Now these health educators will need actually to see what type of data collection has been made based on the information being coming from the data. So they have to review their method of education, and these health educators actually make use of research in order to improve their practices. In some places they might use also flip charts, or they might use the full charts which are shown, nice colorful charts, pictures, and they might use flip cards, they might use overturning leaf charts. So whatever method you feel will be acceptable in that particular circumstances must be done. So in other words, another rule to remember, that health educators cannot use the same technique everywhere. Their technique must be directly proportional to the type of public, to the type of area, to the education in the area, to the social practices and the norms in the area. So health education matters on a lot of fronts. Now, responsibility 5. How to administer health education strategies, interventions and programs. Administration is generally a function of the more experienced practitioner, and it involves facilitating cooperation amongst personnel both within and between the programs. And this is important because time and again, situations, people, education, social conditions, social norms, they all vary from place to place and from the educator to educator. So he has to keep in mind his training background and the place where he is working, because in order to give most effective health care. Most important, this health educationist, this resource person, he serves as a resource person, and he has the skills to access the needed resources, establish effective consultative relationship. So basically he is a very important joint in the community understanding. This health educator is a person whom we have to respect for his knowledge, for his technique, for his guidance, for his counseling and for his cementing of community participation. Most important. In the responsibility 7, he has also to communicate and advocate for health and health education. In other words, he has to translate scientific language into understandable information. See, he has the scientific language and he knows what the science is meaning to tell, but he has to explain this in very simple language he has to put it in a language which will be acceptable, which will be understandable, and which will be workable in the situation in which he is going to educate. Then, besides, we must remember, he has to address diverse audiences. Might be school teachers, might be villagers, might be gram pradhan. So, according to the situation as and when it develops, he has to change his techniques. He has to change the quality of the information. He has to change the simplicity of the information. In other words, he has to formulate and support rules, policies, and legislation. And he has to advocate, he has to become an advocate for the profession of health education. It is definitely desirable to have one health educator in every primary health center. However, at least one health educator should be available in each block. That is at the block headquarter level of the primary health center. So, this health educator actually acts as an intermediary between the block and the block headquarter level, the primary health center. Because normally, as I said in one of my lectures, if you see in most of the blocks, I'm giving you an example of the primary health center in Chiregaon block. Now, both the block headquarter and the Chiregaon primary health center are placed side by side, so that this health educator and the other personals actually they work hand in hand. So, if a person goes into the field, he needs requirements. Collectively, all of them put together in order to help him and make him acceptable, make his mind acceptable to what they are trying to teach. So, he or she will be under the immediate administrative control of the PHC medical officer, and he or she will be responsible for providing support to all the health and family welfare programs in the block. So, wherever needed, he will be called upon basically as a resource person. So, if a health educator female or a health educator male, he goes into the field at the primary health center and he finds that there is a resistance in the acceptance of his services and education by the rural areas, he immediately calls upon this health educator to help him. And immediately this particular team sets to go into that area, and he teaches in such a fashion so as to break down the resistance and make their services, make their education acceptable by the community. Now, duties and functions of the health educator at the primary health center. A few duties I have been all the time mentioning, but now this is to enumerate and to revise. So, he will have with him all information relevant to the development activities in the block, and he will develop his or her work plan in consultation with the medical officer of his or her primary health center and the concerned block extension educator. I have just given a very good example of, say, family planning. The health worker male or the health worker female goes into the service area and they try to talk to a person or a community, small community, and it is invariably seen that if one person resists the acceptance of knowledge and practice of, say, family planning, this resistance is bound to spread between one or two families in that area. So, what happens is that ultimately you have your health worker male and the female talking to a group of resistant minded village level at that place. Now, this should be a warning bell to this health worker male or the health worker female that I am in difficulty and my level of difficulty can only be helped by the block extension educator, in which case he says his goodbyes, leaves the place amicably to come back the next day with this extension of educator, who will then slowly cut into the resistance and make the program acceptable to at the field level. He will then also be solely responsible for the proper functioning of the primary health center and activities in relation to the RCH, that is the Reproductive Child Health, the National Rural Health Mission, and other national programs. We have been talking that national programs are running through the primary health center, through the community health center, through the sub-centers, and this is where our health educators are based at the primary health centers. So that means he will be closely involved with the national health programs. He will also be responsible for organizing information, education, and communication activities relating to health and family welfare programs in the primary health center or the block area. He would also be under the immediate administrative control of the medical officer of the PHC, and he will function under the technical supervision and guidance of the district mass education and information officer. So he also has a supervisor in the form of a district education and information officer. He is also known as the DEO. His main functioning would relate to the promotion of health and family welfare programs. Now, where are these health educators? If there is any widespread education which has to be given, so then the main work of the health educator comes in, because it is important to know that this man would be able to indicate how and when and where to promote healthcare activities, and to see that this knowledge becomes in an acceptable form at the field level. So if fairs are organized, if melas are organized, the work of the health educator becomes very important, and this work therefore leads to acceptance at the community level very comfortably. He will also construct the district health officer in formulating the special programs for his primary health center, and apart from these special occasions, he will also be effectively taking part in any of the meetings, in any of the activities, in all the national programs. So he becomes a part and parcel of the activities of the primary health center. Besides just like the other workers, he has also to collect, analyze, and interpret the data in respect of extension education work in his or her PHC area. He will also be responsible for regular maintenance of records of educational activities, tour programs, daily diaries, and other registers. In other words, he also has to assist the medical officer, the primary health center, in conducting training of health workers and ASHAs. And most important, he has to organize the celebration of health days. This is exactly what I was talking just a few minutes ago. In the organization and celebration of the health days and weeks, and the publicity which is necessary, publicity programs at the local fairs or market days. So he will set up the health education posters. It becomes a nice mela and a very fair looking market, and people are selling goods. There are announcements being made. Songs have been created on health education, family planning, on the other subjects. So it is actually a celebration day. And in this celebration of health days or World Health Day or National Immunization Day or National Malaria Day, so depending on what the topic is, he creates a market for education through several methods. So there may be video shows going on, there may be films running, there may be posters. Then he puts up colored pamphlets are being distributed, and people are acting plays. Nukkad Natak can go on. So Nukkad Natak has now, a word about Nukkad Natak. It's very interesting to know that there are groups who are doing these Nukkad Nataks in hospitals, on roads, and they collect group people together. So they take any simple subject and they self-act it out there itself. This act will never extend for more than 10 to 15 minutes, and this little crowd there enjoys the acting and then goes about its work. But the most important thing is that the information and the education has been distributed, and maybe at times it has been accepted very comfortably by the people at large. He has also to organize orientation training and help to the family welfare workers, the opinion leaders, local medical practitioners, school teachers, DIs, and other involved in health and family welfare work. So, in other words, he acts like a nodal person. He works not only with the people who are working in the primary health center setup or in this government setup, he also approaches the NGOs or the non-governmental functionings so that he is able to include them in his teaching program. So he may go to the Zilla Panchayat, or he may go to the Panchayat, he may go to the village groups, he may go to the Gram Pradhans and include them in his lectures so that his education becomes more acceptable and more in demand by the public, because they know that he is a man to be trusted, because he is standing hand in hand with our leaders. So, in other words, he assists organizing mass communication programs like film shows, exhibition, lectures, dramas. Then he supervises the work of the field workers in the area of education and motivation. Now, another word about health education. Health education is such a subject that it is not only limited. We are not talking only in terms of limiting it to the field or to the primary health centers or to the community health centers. Health education is a subject of the group of the population, and it can be done there is no time and there is no place good enough for this. It can be done at any time. Basically, a health educator sitting in the night drinking tea with a group of village workers, he can start educating them at that time itself. Or people sitting together eating food after working in the field, he can start education. If he is traveling in the train, there is no problem. He can sit and educate there also. So, it's a question of how and where his acceptance of information will be at the happiest. But in any case, he is there to disseminate knowledge, and that too affordable and effective knowledge. In case of control of communicable diseases, health education commonly includes an appraisal of what is known by the population about a disease and assessment of habits and attitudes of the people as they relate to the spread and frequency of disease, and the presentation of specific means to remedy observed deficiencies. He will also supply educational material on health and family welfare to the health workers in the block. He will verify entries in the eligible couple register for every village. In other words, wherever people cannot communicate effectively, directly with the community at large, health educators are brought in as a means to improve the transmission of knowledge. Apart from supplying educational material on health and family welfare and on the other subjects, he will verify entries, record maintenance, very important. He will verify entries in the eligible couple register for every village. He will also check the available stock of conventional contraceptives with the depot holders and with the kits of the health workers and the ASHAs, and with the help of field workers in winning over resistant cases and dropouts in the health and family welfare programs. For example, Mission Indradhanush was launched on 25th of December 2014 to reach those children who are left out in the universal immunization program in order to increase immunization coverage. And he will also help to maintain a complete set of educational aids on health and family welfare for his or her own use and for training purposes. He will also help to organize population education and health education sessions in school and for out of school children and youth. He will also maintain a list of prominent acceptors of the family planning method and opinion village wise. He will also try to involve them in the promotion of health and family welfare programs. He will also prepare a monthly report on the progress of educational activities in the block, send it to the higher authorities, and health promotion related IEC and VCC activities are a part and parcel of his activities. Now, to summarize, health education is an effective tool that helps improve health in the developing nations. It not only teaches prevention and basic knowledge, but also conditions ideas that reshape everyday habits of the people with unhealthy lifestyles in developing countries. This type of conditioning not only affects the immediate recipients of such education but also future generations, and a health educator is a professionally prepared individual who serves in a variety of roles and is specifically trained to use appropriate educational strategies and methods to facilitate the development of policies, procedures, interventions, and systems conducive to the health of individual groups and communities. He develops his or her work plan in consultation with the medical officer of his or her primary health center and the concerned block extension educator. He or she also promotes health-related information, education, communication, and PCC activities. In other words, he is the nodal point of all these activities, and it is through him that we can improve communication, education, and the disbursement of information right down to the grassroots level. Thank you and welcome to ePathshala.